Good day, doctor. Today, topic, sagittal correction. You know, it used to be that we corrected transverse first, expansion. We did some level and aligning in whatever order you wished. And then we worried about class 2 or class 3 correction. No more. That's the old-fashioned way to do it. That's the less efficient. That's the less effective. That's the less fun. That's the longer. Now we have sagittal correctors. D2, made by OrthoArch Company, is one that is just fantastic because as you place the sagittal corrector, you're embarking on the opportunity to transform a life radically, quickly, easily, and for a long time to come. Now, let me just give you an example. Here you are with a patient with crowded upper incisors. Maybe the upper twos are crowded out or rotated severely. There's no space to correct them. You could protrude them to do that. But no, all you need to do is put on your class 2 sagittal correctors, your D2s, and put on a lower lingual arch. Some people like to use an Essex with a hook on the 6s. I prefer the lingual arch because it's one less thing that the patient has to comply and utilize. And you're going to hook a class 2 rubber band up, starting with either 4 or 6 ounces from the sagittal corrector on the anterior, which might be a D, might be a 4, might be a 3, might be a C, and run it down to the lower 6-year molar. As those upper 3 or 4 to 6 teeth distalize sectional mechanics, all of a sudden you have room, space in the arch to straighten the upper incisors. It's absolutely incredible. You don't have to protrude them to do it. You don't have to temporarily protrude them to do it. It's really amazing. Yesterday, I had a call from an orthodontist colleague of mine, and his quote to me was, "I love these appliances." Because something that used to be very difficult for us to accomplish because the patient compliance was poor, because it took a long time, because it was hard to suck it in, as we say, to a really good class 1, is now easy, effective, efficient. Why? Sectional mechanics. And you're starting at the beginning of treatment where the patient is most compliant, most willing, and it takes less time, so you're asking for less time of compliance. It's an absolute miracle for all of us in orthodontics. Doctor, if you aren't using sagittal correctors, and you can use whatever brand, there are 2 basically out there. There's the D2, which is a 2-piece, which can be very useful in placement. And then there's the Motion, which is a 1-piece. But whatever you do, use sagittal correctors. Don't wait. Don't frustrate yourself and your patients any longer. Don't get half-hearted results. Don't get results that don't please you, that aren't the best that you can get. Really, honestly, they are miraculous. We all love them. You will too. If you're not already using them, it's time to start. I love you, Dr. Chris, signing off.